Good afternoon to everybody. I think this is a good news that TransplantChild can have a new exchange program which enables some visits in another centers of members of our network. So I think it will be interesting for everybody. Most of these details are available on the TransplantChild web, but I think we can shortly summarize how to apply, how to participate in this program, and to respond to some questions, because it's important that everybody got the news, got the message that it is possible to participate. So this program is for this year and to the end of this period of the project. So if you can help me, Jorge, and show the next slide. Just the general information that the exchange program is aimed to share knowledge, science, and to increase and strengthen collaboration and cooperation between healthcare professionals in our European reference network, TransplantChild. And what is important, that this exchange program grants are for the professionals who are dedicated to pediatric transplantation and want to spend some short-term visits and stays in any of the 40 healthcare providers, members, or affiliated partners of the network. It is important, of course, that it is dedicated for these exchanges for and among in between the members or affiliated partners of the network. So I will shortly try to introduce how to arrange, how to apply, and how to arrange this visit, and what are the conditions to participate, and how it will be also covered by the financed by the TransplantChild. And next one, please. So just who is eligible to apply? So as I just told, these are for all professionals who are full members or affiliated partners of TransplantChild, and the preconditions are also that visitors must have valid medical coverage and professional liability insurance. Those not eligible for the European Health Insurance Card must obtain private insurance. Additional requirements may vary by host institution and will be communicated by the technical secretariat when the particular center will be chosen by the applicant. Non-members are unfortunately not eligible to apply. So this is for the members. The visits, because of the amount of finances, and the visit may last from mostly 1 to 2 weeks at most, and there is a survey prepared to choose the centers of interest and to match the visitor with the chosen center. Funding will be provided according to the criteria of promoting equity among the different centers and the professions, specialists, to ensure that the funding is awarded to different specialties. Of course, it also depends on the number of applications and who will apply. So this will be, of course, screened after the period of application we finish. So next, please. So what is the procedure for participating? So on the TransplantChild website, there is a exchange program in the menu, and one can register by completing the survey. This is the link to this survey, and it's important to fill the survey with all the information. Select the center, have some to put some information on the aim of the visit and what are expected benefits of this visit, and just to make us to the committee who will be deciding after the applications will come to have some basis for choosing the applicants. And the deadline for registration for the application is April 15. Once the deadline will pass, there will be an evaluation committee which will analyze all the proposals received, and the TransplantChild Technical Secretariat will contact all participants to communicate the decision and proceed with the next steps. So it is very important to apply before the April 15, please remember, and to fill all this survey with some the background and of the aim of this visit. Next, please. So this is just the screenshots from the application form. There are just the general data on the applicants, on the institution, the communication, expertise area. Next, please. Just to on the details of the exchange program objectives and activities which candidate want to perform, and expected results of these visits. Just short information, proposed dates, and healthcare provider which will the chosen host center for this visit. Next, please. And which is very important to make a choice from the list, which is also available on the website. I will show it also shortly. So the reimbursement policy for the visits are as follows. The visitors will be not responsible for booking on travel and accommodation. This will be done by TransplantChild, and will not be responsible for booking or paying their own travel and accommodation. And these arrangements will be covered directly by TransplantChild. Subsistence costs, including meals, local transportation, will be reimbursed in accordance with European Union unit costs rules for subsistence. So it will be limited to reasonable and necessary expenses incurred during the stay and within the established maximum daily allowance. And participants are reminded that all subsistence expenses must comply with the principles of cost efficiency, necessity, and sound financial management, and that the maximum reimbursement limit applies. So if visitors cancel their trip after purchasing travel and accommodation, if visitors cancel their trip after arrangements have been purchased, they will be required to cover any non-refundable expenses. So this is also very important. Next, please. So, and the end of the fellow of this visit, the applicants will be asked to provide a short, really short report on their activity at the host institute. It should be sent to TransplantChild coordinator within 3 months of completing the visit time. So this report should not be longer than 2 pages, just to imagine, and should just summarize the results as well as possible plans for further work or cooperation to be undertaken. Next, please. And concerning the host eligibility, in exchange program, hosts can be full member of affiliated partners, healthcare providers, and any costs incurred by hosts are not eligible for reimbursement by TransplantChild. So this is on the host side. Next, please. And of course, I will not go in detail on this table. It is available on the website, but there you can see all the hosting centers which offered themselves as a host institutions, and under each center host center there is a spectrum of transplant activities or specialties which can be chosen by candidates. So some offer only one specialty or activity, like liver, kidney. Some various many other transplant types, like heart, intestinal, liver, lung, bone marrow, etc. So next, please. And the next one. So there is many places to choose. Very interesting and good transplant centers. So I'm sure everybody who is interested in the exchange program can find for himself or herself a place for very interesting and valuable experience and visiting in another center. So as I mentioned before, you can find all these details on the website. And you can also access the registration survey by this code, Bayer code. There are links also to the survey of the exchange program and on the information on the exchange program. Next. So this is just the picture which shows in a nice view on the way of application of evaluation process and how the route of application and finalizing the exchange program is going to be done at the end with the report of this visit.